a 10-minute presentation by Dr. Kelechi Ohiri, who's the Director General, Chief Executive Officer of the National Health Insurance Authority, NHIA. Is he here?
Yes, he is. And while he makes his way on the stage, I'd like to tell the audience a little bit about him.
Please.
He has authored policy papers, peer-reviewed publications, and co-authored books on health systems. And he has also contributed to expert advisory committees for the Institute of Medicine, the U.S. Centers for Disease Control Prevention, the World Bank, the Global Fund, and the World Health Organization. Let's put our hands together for him. Welcome to the stage. We'll bring you one.
Good morning. Please permit me to stand on the already established protocol for today. And I'll also like to join everyone in congratulating BusinessDay on their 24th anniversary. And congratulations, and I wish you many more successful years ahead. I just want to, for the few minutes I have, write on the presentations that were made, but also bring a different perspective to the conversations we've had today. A lot has been said about reforms and recovery. I think recently it was the anniversary of Chinua Achebe's book, Things Fall Apart. Chinua Achebe is someone that we all know very well for his great work in fiction, but less well known are his interests in politics and in development. Politically, he was very involved in the progressive movement and was actually running mate to the late Malam Aminu Kano. But the parts of his career and life I want to highlight is that of development, where when invited by one of my previous employers, the World Bank, to speak about Africa, he listened to macroeconomists talk, and they talked about GDP growth, they talked about the infrastructure needs and gaps, etc. And when he was in turn to make his presentation, he said something. He said, Africa is people. GDP, statistics, infrastructure, all important. But at the end of the day, Africa is people and Nigeria is people. So I'm not sure this is working very well. Okay, great. We know that Nigeria faces a lot of demographic and economic challenges. I won't belabor the fact. We have a broad-based population pyramid because we still have high mortality rates, particularly infant mortality rates, low human capital index, high poverty rates, not news to all of us. And these have resulted in poor health outcomes that we've seen. It's not all doom and gloom, because Nigeria also has a positive working age to non-working age population. So what we characterize as the demographic dividend just means that those who are in the working age brackets outnumber those who are in the non-working age brackets. And that's important because all the studies have shown that this can be and can spur economic growth. And so a comparison was made between Nigeria and Indonesia. And so one looks at this. In 1980, Indonesia, like Nigeria, had the same broad-based population pyramid. High infant mortality, so children born didn't make it, and so hence the pyramidal nature. But by 2025, the picture began to look a bit different. In countries like Indonesia, it became more rectangular because as cohorts of populations grew, it meant more people came into the working age population. But Nigeria has fairly remained stagnant in the sense that even though we have high fertility rates and more births, because of the high mortality rates, we're not getting as many people going into the working age group. And when you look at the health outcomes in the two countries, it also suggests that. So why aren't we investing a lot? One of the things to note is that when you look at health expenditure in Nigeria compared to other countries, most people pay for healthcare out of pocket. So that means if you don't have a pocket, you don't pay for healthcare. And there was a World Bank publication that shared that about 1 million people every year are pushed into poverty due to illness and significant out-of-pocket expenditure. These are your potential customers, these are our clients, these are people we know. And what that means is that the success we've had over the years in economic growth and creating a middle class is so fragile that you're one catastrophic illness away from selling all your assets, emptying your bank account, and being plunged back into financial vulnerability. Hence the need for out-of-pocket spending to reduce. So overall, when we look at what the challenge and the opportunities are, we know that there's a potential to strengthen the safety net in Nigeria. There's a potential to unlock the demographic dividend. And thirdly, there's an opportunity to accelerate industrialization. So how do we do this? So in terms of reforms, a lot of the reforms in the health sector that were launched by His Excellency Mr. President and anchored by the Coordinating Minister for Health and Economy, all geared towards saving lives, reducing both physical and financial pain, and producing health for all Nigerians across 4 pillars. The pillars include effective governance, an equitable and efficient quality health system, unlocking healthcare value chains, and of course, health security. We all lived through COVID. And different agencies are responsible for these. And the NHIA anchored on this, we focused on 4 main pillars: expanding access to financial protection, improving equity, improving quality of care, and market efficiency. And the reason for that is, first, when we take on coverage, we know about 70% of Nigerians still pay for healthcare out of pocket. And that vulnerability means except you have more people covered and provide that safety net, more people will encounter the vulnerabilities that come with poor access to healthcare. But secondly, even as we expand coverage, even if we embark on these reforms, it's not enough to wait for things to trickle down. And that's why equity can't be something we hope will happen eventually to people. It has to be targeted, it has to be focused. Economic growth doesn't always translate into poverty reduction. You have to target poverty reduction. Hence, we embarked on a few equity programs and ensuring that the poor are covered as part of the reforms. Thirdly, of course, improving quality of care. And lastly, looking at the payer market and trying to make it more efficient to serve Nigerians. I'll just give a nod to one of the other reforms in the PVAC initiative, which was established by Mr. President in 2023, with the aim of unlocking billions of dollars in investments so that we would increase healthcare jobs, reduce outbound medical tourism. It's estimated about $2 billion every year is spent in outbound medical tourism for things that could potentially be treated in Nigeria, saving foreign exchange and also building a healthcare industry. And then the third thing is about domestic manufacturing of drugs and commodities. One of the things we witnessed during COVID was the breakdown of the global supply chain, which meant that every country had to rely on what it could produce. Nigeria can't wait for that next major pandemic to realize that it has to be able to produce the drugs it consumes, the devices it uses, and other consumables and services that its citizens need. So these reforms will end up giving us these 3 outcomes. Next slide. Okay. So what have we done so far? And how have we built the momentum for recovery? So first, we'll look at 4 areas: coverage, market performance, equity, and the healthcare value chain. In terms of coverage, in the last year and a half, well, we came in and were given a target that by 2027, we need to hit about 20 plus million Nigerians being covered with health insurance. It's Q2 2025, and we're already 97% there. And then we began to launch additional reforms. One was to establish a mandatory minimum of what a benefit package for healthcare is. Second was building on decentralization, working with states, so that every state in Nigeria now has a health insurance scheme. Then we also looked at tariffs, and this had to be done through actuarial studies and analysis, so that we move from arbitrary policies to actually basing policies on evidence. And this resulted in a 93% increase in capitation payments to providers. This is how much we give to hospitals so that they cover people under them. And then fee for service, which meant the tariffs that we pay for people to get care was increased by 378%. And all this was to kickstart the system so it begins to provide good quality care, but also attract healthcare providers to come in knowing that their services will be properly and adequately reimbursed. On equity, we also launched a few programs targeted at maternal health, because Nigeria unfortunately still has some of the highest rates of maternal mortality. So two of them I'll just highlight. One is on ensuring that women with a debilitating condition who may not die in childbirth but have something called fistula are treated. So right now the government reforms are such that if any woman has this condition, you show up at any accredited facility, the government pays, and then you get enrolled in health insurance. In less than a year, about 3,000 women have benefited from that. Same thing applies for women who die during childbirth. So we're working with over 250 hospitals in Nigeria to ensure that if a woman has an obstetric emergency, the days where you'll be told, go and look for money and come back, we're saying that we need to put those behind us. So across over 250 accredited hospitals in Nigeria, in every state, and those numbers are increasing as long as they meet quality thresholds. The woman is in labor and can't afford it and shows up, that care will be taken care of, NHIA will be built, and that payment will be made. So far, about 5,000 women as at May have benefited from this program that started in October. Then the government in the National Health Act passed a law that at least 1% of consolidated government revenue goes into primary care. Half of that covers insurance for the poor. And right now, about 2.7 million Nigerians are covered by that. And that is law. So again, for sustainability, we see that. In terms of the value chain work that is being led by my colleague, Dr. Abdul, we know that over $1 billion has been mobilized from the European Investment Bank mechanism, another $1 billion through Afrexim Bank. Certain value chains have been prioritized, and this work is to catalyze that reform and transformation in the private sector so that we begin to unlock its potential and be more self-dependent. Given time, I'll just land on this. A lot of reforms have been put in place in the health sector, and there are certain themes that have emerged. One is there's a need to strengthen the social safety net for the country, because economic growth, or whatever we do without a strong social safety net, brings a level of vulnerability that creates fragility in all the reforms we're doing and in all the growth we have. Secondly, it's important to understand that Nigeria is at an inflection point where investing in human capital is not just does not just have intrinsic value, but also it's a precursor and a determinant of economic growth, as seen in Asia, in countries like Indonesia. And thirdly, we need to begin to construe the health sector not just as something charitable, but as a key contributor to economic growth and to the growth of our GDP. And this we will achieve through industrialization, unlocking the healthcare value chain, and catalyzing investments through a public-private collaboration in the health sector. So my time is limited. Well, I'll stop here, and thank you for the opportunity to share a more human perspective to this. And I think my parting words will be those of Chinua Achebe, that in everything we do, and as chief executives, and as we fight for and look for economic growth and all the indices, always understand that at the center of it are people, human capital development, because ultimately Nigeria is people, and they have to feel the impact of all the reforms and all the transformation that is going on. Thank you very much.